Welcome back to Brisbane Health. We've talked about the benefits of volunteering and the positive impact on volunteers' lives. Now, Perry, can you tell us what should a person consider when they're going to volunteer for an organisation?
Okay, volunteering I tend to think is a very personal choice, and I think it's the best way to do it is for individuals to start to think about themselves first, if I can put it that way. What are they interested in? Why do they want to get involved in a community organisation? What their time availability is, what days of the week, for example, they're going to be available, because when they end up talking at interview with the organisation, they're going to be asked these sorts of questions. So it's good to think about those sorts of things right from the beginning. Some people are going to be very, very passionate about a cause, and it may be often it's a health-related issue that's affected them or their families, and they'll probably know where to go, what organisation to go to talk about that, to see if there's a role that they can play. Other people may be not so sure about where they want to work or what type of work they'd like to do in volunteering, so they can go to a website like ours, for example, volunteeringqld.org.au. And we have a linky service there where people can scroll through or browse through the categories of work that are available, the locations that they're available, and there are job descriptions up there that organisations have posted. So just like any sort of a job, you can read what the requirements of the job are, and again just see, does that match my time availability? Is that something that's really going to interest me? So it's really about having a little bit of a think about what is motivating you to volunteer. We've had a long period in our history with past generations with what we've called the so-called traditional volunteer that was very altruistic, coming from the old sayings, the old adage of it's better to give than receive. And that was a very powerful motivation for volunteering through many, many decades last century. We've moved into a phase now where people are time poor. There's a lot of distractions. Demographic trends are impacting on volunteering, and of course, technology has changed rapidly and continuing to change. So it's altering the way people are often thinking about how they want to get involved in things. For some people, it'll be more interest in perhaps an event, a short term, whereas a clear start and finish time to the period, and then they can go back to what else they're doing. Others might be involved almost in a spontaneous way, as we saw with the disasters in Queensland and other parts of Australia, that triggers a generosity within all of us to want to help and assist others. So there's a whole range, again, an enormously diverse field of motivations and mixed feelings around it. But it's asking ourselves first, what would interest me? What sort of skills might I want to learn? What skills can I apply that would be of benefit to an organisation? And so on. I could go on.
So you were speaking about time implications before. What sort of time might it take a person, say someone like me, who wants to get involved with something? What sort of time am I looking at?
It's one of the beauties of volunteering. You can almost tailor, a role to suit your own time. And this is one of the challenges for organisations in human resource management, is to manage the workload with a very, very part-time workforce of volunteers. So the standards that are out there, the national standards, talk about no more than, say, 2 days a week for many people. For some, they might want to volunteer more hours than that. For others, that's way too much. Perhaps it's 1 day a week, or perhaps it's 1 day a fortnight. Or, as I say, perhaps it's a project which starts and goes for a month or a couple of weeks and then ends. And then they leave volunteering and come back to it in an episodic way. So it's a matter of speaking to the organisation that you're thinking about joining talking to their volunteer coordinator and tailoring an arrangement that is mutually convenient for both parties. Obviously there has to be a commitment to the organisation, because the organisation's trying to deliver services and achieve certain objectives that they may be funded to do or not. So the reliability needs to be there, and there's a set of we publish on our website a checklist, for example, where volunteers can look through that checklist, and it asks all of these sorts of questions. Is it important for them, for example, to work in an organisation where they're covered by insurance if they're injured? Because some organisations will have that insurance and some won't. So lots and lots of questions like that. So the fact sheets on our website is a good place for people to start.
I see. And if people have certain skills and things, maybe in the nursing side of things or sports side of things, there'd be something for them on the website? Of
course, yes. And I think a large number of people become involved in volunteering through those sorts of channels. I know my formal volunteering in my life commenced when my kids were very young and went to kindy. So I saw the value in getting onto the management committee of the kindergarten, and then as they go through primary and high school, you follow through and you get involved in the working bees or perhaps in the tuck shops and all of these sorts of things. But yes, there's so many avenues for getting into volunteering in an almost unconscious way like that, because there are a lot of people who are volunteering and contributing to organisations, and they don't put that volunteer tag on themselves. They don't think of themselves as volunteers. It's just part of engaging with community or with society in so many, many different ways. And yes, if it's health, well, obviously, you look to the hospitals and other sorts of medical practices that might be able to need support in that way. Again, as I said earlier, look at what you can bring to that organisation that would contribute to that organisation, and also enable you to practice your skills and learn new ones, of course.
Can you give me some examples of those hospital type organisations? Is there anything?
Look, there are many. The fields in which people can consider getting involved are so enormous. There's almost all of the hospitals will have programs running where they have volunteer programs. Often it's in a support capacity to perhaps even just to read to patients or to residents in an aged care facility and so on. A lot of it is human contact work, which is so important. It's not always in human hospitals. It might be in an animal hospital, caring for the animals, working as a volunteer in an animal ambulance role. It might be looking after the puppies, for the Guide Dog Association or the RSPCA and so on. There's some fantastically interesting and meaningful jobs like that. And if someone looks on our website or just Googles these sorts of things even, they'll find hundreds, if not thousands, of opportunities. We have about, on our website alone, we have about 2,500 opportunities across about 1,800 organisations. So it's a massive opportunity there, and we believe there is a role for everyone in society to play in contributing to their community in these ways.
We'll be back right after the break to discuss some major volunteering projects.